The most dangerous 4 words the patient can say to themselves are, "It's just a hemorrhoid." You notice a little bit of bright red blood, maybe some irritation. You tell yourself it's because you're strained, you sat for too long, or you ate something spicy. You assume it's harmless. And most of the time you are right, it is harmless. But here's the problem. Colon cancer hides inside that assumption. I'm Dr. Chovanec, and as a medical oncologist, I see more and more patients who ignore rectal bleeding for months because they are convinced it's just hemorrhoids. And by the time they come to the medical attention, their disease is far more advanced than it ever needed to be. Because here's the uncomfortable truth. You cannot tell the difference just by looking. Before we start talking about the warning signs, we need to clear up one important misunderstanding. You may have heard that colon cancer is rising in younger adults, and that is absolutely true. It is one of the fastest rising cancer in people under 50. But this is not only a young person's problem. Colon cancer is still the most common in older adults, and the absolute risk remains highest as we age. What has changed is who gets missed. Younger adults are often dismissed because they are quote-unquote too young, and older adults are often falsely reassured because their symptoms are blamed on hemorrhoids, diverticulosis, medication, or simply getting older. In both cases, the result is the same, a dangerous delay in diagnosis. And the reason this cancer slips through is because the early colon cancer is quiet. It doesn't hurt, it doesn't stop you from working, it often doesn't feel urgent. And because the symptoms involve the bathroom, people delay talking about them. So think of this video as a private checklist, not to panic, but to recognize patterns that should never be ignored. Let's start with the most common warning signs and the one that is most often overlooked, the rectal bleeding. People ask, how do I tell hemorrhoid from cancer? The goal is not to diagnose yourself. The goal is to know when bleeding should not be assumed to be harmless. Clinically, we pay attention to 3 things: color, mixing, and persistence. First, color. Hemorrhoids often cause bright red blood on a toilet paper or in the bowl. Colon cancer can also cause bright red bleeding if it's located lower in the rectum. But darker blood like maroon, tar-like, or black is often associated with bleeding from higher parts of colon and is much less likely to be a simple bleeding hemorrhoid. Second, mixing. If blood is mixed into the stool, streaked through rather than sitting on top, that means that bleeding entered the stool earlier in the digestive tract. That requires proper medical evaluation. Third and most important is persistence. Hemorrhoids tend to flare then heal, the cancer does not. If bleeding continues week after week, regardless diet or straining, that is not something to watch. That needs investigation, usually with colonoscopy, which is basically bringing a tube through your anus into your colon and looking through the whole colon with a camera. And importantly, this investigation most commonly finds something benign. That is exactly what we want. The second warning is a persistent change in bowel habits. This is not an occasional constipation, this is not a bad week, this is a new normal. If you had a same bowel routine for years and suddenly without any explanation this changes, you're constipated for weeks or you have ongoing diarrhea that doesn't react to dietary changes, that matters. There's also a physical clue that many people don't recognize. If something is narrowing in the colon, the stool may have a problem passing through. It comes out thinner or flatter. Sometimes we even describe it as a pencil-thin stools. If that change is consistent, it is a mechanical sign that something may be obstructing the passage. That deserves evaluation. The third sign may be subtle and often difficult to describe. In medicine, we call it a tenesmus. It is the sensation that you need to have a bowel movement, but if you go very little or nothing comes out, or you go and still feel unfinished. This can happen when a growing tumor in a rectum irritates the bowel walls. Your nervous system senses that something is there and keeps sending signals to empty even though there is no stool to pass. If you are constantly feeling the urge to go with repeated false alarms, this is not constipation. It is a signaling problem that needs to be checked. The fourth sign doesn't show up in a toilet. You feel it in your energy. Cancers on right side of the colon often bleed slowly drop by drop. You don't see any blood. Over time, iron levels fall down. You feel tired, you get winded easily, and you look pale. And if you go for a blood test, it shows iron deficiency anemia. Here is a simple medical rule. Men should not be anemic, and also women in a postmenopausal age should not be anemic as well. If iron is low, we have to ask, where is the blood loss coming from? And treating anemia without finding the source is not enough. The final signs are the ones we hope to catch before they even appear. Unexplained weight loss or abdominal pain. If you are not trying to lose weight and you drop 10 to 15 pounds over a short period of time, your body is under stress. Combine that with dull abdominal or back ache, not a sharp gas pain, but something that lingers, and the picture becomes more concerning. These are often later signs of growing disease in your belly. Now let's talk briefly about screening, because this is where often confusion causes harm. There are two different screening strategies, and they are not meant to be mixed. With people at average risk, the screening starts at the age of 45. Option 1 is a stool test, often called FIT or fecal occult blood test. This test looks for a microscopic signs of blood in your stool not visible to the naked eye. If you choose this approach, the test must be done every year. A positive test means you need colonoscopy, not a repeat FIT. A negative test is reassuring only if you have no symptoms. Option 2 is colonoscopy. A colonoscopy doesn't just detect cancer, it can also prevent it by detecting small precancerous lesions that could be removed, or it can even remove small cancerous lesions. And if the colonoscopy is normal, it usually has to be repeated only after 10 years. Here is the key rule to remember. The FIT test is for people without symptoms, and the colonoscopy is for people with symptoms or in a high-risk population. If you have bleeding, anemia, weight loss, or bowel changes, a negative FIT test does not replace colonoscopy. Just remember that symptoms always overrule screening tests. The common thread in all this is a change. If something is new, persistent, and unexplained, don't try to explain it away. Talk to your doctor, ask if you are up to date with your colon cancer screening. Colon cancer is one of the cancers we can truly prevent, but only if we are looking properly. Now there's another cancer where denying the symptoms is also a mistake. In the next video, I'll explain prostate cancer and the PSA test that causes so much confusion and unnecessary fear. If you want to understand what matters in those numbers, make sure you are subscribed. I'm Dr. Chovanec. Thank you for watching, and I'll see you in the next one.